Let's talk about something else, infections. Traditional medicine treats pretty much every infection, viral or bacterial, with antibiotics. There is a push trying to get that to change, and there is some changes taking place. There are some physicians that are refusing to treat what are obvious viruses. But Dr. Besser, I mentioned that a little earlier, of the CDC, in 1998, said there was 20 million prescriptions of inappropriate use per year in 1998, and then in 2003 he said there's tens of millions, inferring that there's much greater than 20 million. So we may not be having really great success with reducing the antibiotic use. A very fascinating study that I saw, and I could not find it in order to get the reference here, but it was fascinating to me because, being basically a pediatrician by training, I spent 9 years as a general pediatrician, and amoxicillin, I think, was used almost as a vitamin. I mean, the kids were just on amoxicillin all the time, these earaches, these throat infections. That was used incessantly. And when I read this report that amoxicillin has absolutely no utility in otitis media in children, and in fact, very careful teasing out of the research demonstrated that there may actually be more ear infections in the children on amoxicillin than in the children that were not taking any antibiotic at all. Surgery for drainage, of course, standard medicine does that. Infections. It's amazing how many infections can be prevented by stopping sugar intake. Sugar affects the immune system, has a direct effect. One of the first patients that I saw when I came to preventive medicine group 7+ years ago was a lady that came in with the baby was probably between 2.5 and 3 months of age and had been on amoxicillin and other antibiotics for almost his whole life because of the ear infection that never went away. And that was the first few months I was there, and I was still trying to get confidence in the system that diet affects the immune system, affects every piece of our body. And I looked her in the eye and I said, the mother was breastfeeding, I said, if you change your diet, then the ear infections are going to go away. She had to get off the sugar, she had to get off the garbage food, the processed foods. I put her on high doses of vitamins and minerals, so she became a healthy individual, and within 2 or 3 weeks, the ear infections disappeared in a baby. Sugar causes the immune system to drop. We've got to fix the diet. We've got to take vitamin C. We've got to take our vitamins. We've got to get the cells functioning so that our systems will overcome the viruses that are already in us. We are not talking about exposure. A lot of people, the teachers used to come into me all the time. I get sick 5 or 6 times a year because I'm a teacher and I'm around all these sick kids. No, you're not sick 5 or 6 times a year because you're around kids. You're sick 5 or 6 times a year because your immune system is depressed and you are reacting to all the viruses that you already have inside your body. If we were to culture what's in our nose and what's in our mouth, what's on our skin, and culture that, we would be absolutely flabbergasted at how many organisms we have in us all the time. We get sick because our immune system is not good, not because we get exposed to another kid with a runny nose. Once we get rid of that, we should be having 0 to 1 infections a year. We will still come down, we will occasionally come down with an infection, a brand new virus that we're exposed to. High doses of vitamin C and Nutricidal. Nutricidal has echinacea in it, Citricidal, and Artemisia. Artemisia got left out. Those are all herbal agents that are capable of fighting infection. Vitamin C, D-mannose for urinary tract infections. The bacteria that's in the urinary tract loves sugar. It thrives on sugar. And so it actually jumps off the bladder wall to the D-mannose, the sugar, and then gets excreted out of the urine. What a simple concept. Instead of using an antibiotic with the risks, allergies and other risks of antibiotics, destroying the gut in the intestinal tract, so now we have the Candida infection, and to use something like D-mannose for urinary tract infections. And I've found that before we introduced this, we were using antibiotics, not on a regular basis, but fairly regular for urinary tract infections. We now have probably cut that in half or less again, the use of antibiotics for urinary tract infections. Lysine is incredibly effective for cold sores.